What's going on, everyone? Welcome to today's pandemic update for Wednesday, April 12th, 2023. This is the day where we usually see a lot of states do weekly reportings. We do have a couple that I'm going to show you. And on the website, haven't added much today. I'm going to be adding some stuff later this evening that I haven't gotten around to yet. Some of it you will see in this video. I did add this about, can you get coronavirus from contaminated surfaces? And I'm going to show you part of that study. And let's start off first with India. India's bad again. India records 7,830 new COVID-19 cases, the highest in over 7 months. So, what does this mean? It means they are still rising at a relatively fast rate. They also added, I believe, 16 new fatalities today. So that's not good as either. That their fatalities, they're not rapidly rising, but they are starting to inch up higher, and that's something we're going to have to watch. As you know, you test positive first, then comes the hospitalization, then comes possibility of ICU, then comes the death. So deaths are the last lagging factor, so we'll have to see what happens as we go down the line. Then we come to this. EU Foreign Policy Chief Josep Borrell has postponed a planned trip to China after testing positive for COVID-19. And yes, I'll read you his canned how he feels. Borrell tweeted, "I'm feeling fine and have no symptoms." It's like they copy and paste this. Either they put they have no symptoms, or they're mild or asymptomatic and feel just fine. And we have seen an array of outcomes down the line from that. Some have actually passed away, sadly. Some had to be rushed to the hospital. Al Rooker, he said he felt great directly 5 days after he tested positive, or however many days it was. Then, as we all know, a couple weeks later, he was rushed to the hospital because he had blood clots. I mean, come on. I don't understand why they just can't be truthful. Or here's the best one. They say they're fine and have no symptoms, but then you see them in a video or something and they're going, every 5 seconds they're coughing. Like, hello, you clearly had a moderate case of COVID if you're coughing that much. Moving on to this about the household surfaces. This has been a cat and mouse, merry-go-round, whatever you want to call it, since the beginning of the pandemic. Who remembers back in 2020? COVID can spread on surfaces. COVID's less likely to spread on surfaces. COVID can spread on surfaces. You better start wiping down everything. Look, we have to assume that it has always been able to spread on surfaces. We've seen what happened in China. China goes in these full-blown suits, these hazmat suits. China knows. Is it the number one way that COVID spreads? No. The number one way is through airborne transmission. But it can also spread on surfaces. It can also spread through the eyes. Some people wear eye protection, and quite frankly, that's a great idea. And you know what? We're coming into the spring allergy season. Probably helps with the allergies as well. A mask will help you with allergies. We know darn well that the mask is effective. I don't care what any study says. More on the mask at the end of this video. Taking a look at this now. Study says COVID infection may accelerate dementia progression. And yes, we've known about this for a long time. This is just another of many, many studies that are coming out on this. And I should add, if you have a history of Alzheimer's or dementia in your family, I can raise my hand. It runs in my dad's side of the family because I took care of my grandmother for 4 years who had Alzheimer's and dementia. She sadly passed of it just a little under 10 years ago. But you want to be especially careful. Take special precautions because you don't want that to happen. It can get really bad. And we're seeing a lot of these cases where we're seeing people just have brain fog, doing weird things. Chances are they had a COVID infection. Alright, moving on to this. I think we're going to add this. Yeah, we'll do this. Study develops a novel model that estimates undetected COVID-19 emergencies. So basically what they did here was they developed a model to check and see how much COVID was undetected at the beginning of the pandemic. I will also add this to the site. We're not going to go through this whole thing. It's rather long and time consuming, but yeah, it's relatively interesting. And I'll add this to the site this evening. No pandemic history for today. We do have several things that we'll get to tomorrow. Let's get to wastewater. And before we get to the CDC site, take a look here at the chart. You can see here the 4 regions have leveled off. The one in green, which is the West Coast, is attempting to start to rise again. So that's interesting. Getting to the national wastewater here. Not much is update. Still moderate to near moderate transmission up in Maine. And low to near moderate in much of New England. Ohio, we still have low to moderate. You see a lot of orange there. Wisconsin, there's a few orange ones. Michigan. We still have this ball of a mess that's going on in Nebraska. I will say this, though. It's slightly better than when we started incorporating wastewater into our videos, but they're just constantly at moderate to high transmission. As we know, Iowa's not reporting anymore. California, we're losing a lot of sites in California. I hope California, for as big as the state they are, they're one of the biggest states in the country, does not go the same path that we see Iowa going down. I'm concerned that we're losing more data. And more about that when we get to Walgreens. Yeah, bad news about Walgreens today. Taking a look at the latest transmission. This will update tomorrow, but let's just give you a rundown. Maybe you're new to the channel. Maybe you haven't seen any of my other videos. Here's what it is. High transmission, 888 counties. Substantial transmission, 581 counties. Moderate transmission, 1,268 counties. Low transmission, 485 counties. Something interesting if you look at this. Much of the Northeast is moderate transmission. The I-95 corridor from South Carolina all the way up to Maine, moderate. Much of California, moderate. Even up in Oregon and Washington, moderate. That's impressive. And here's the thing that really is kind of odd. The Four Corners region has a bunch of substantial and high counties. You also have the Great Lakes region, which has a lot of substantial and high counties, so it's really different right now. Remember when we used to have Texas on up through the plains? It was just constantly low to moderate. And, you know, somewhat it still is. But then you come into Oklahoma, there's a lot of moderate to high. And you're seeing a lot of these moderate to high areas being areas that are less vaccinated. I'm not saying because it's less vaccinated. It just happens to fall in those areas. Alright, let's go on to the variant proportion. And on the variant proportion, we can see XBB15 is at 88.3%, XBB191 is at 5.1%, XBB151 is at 2.4%, XBB is at 1.9%, and BQ1.1 is at 1.4%. New variant update will come out Friday. Hopefully, it will include XBB116, and hopefully it comes out at all because, as you know, the pandemic emergency just ended. So if it does come out Friday, we'll have a video either Friday or Saturday. Alright, moving on to this. And taking a look here at Mount Nittany Medical Center. This is the only hospital in Center County, Pennsylvania. It's saying here 3 hospitalizations. That's actually incorrect. I'll show you why. So we want to take a look at Center County. Pennsylvania just updated today. I don't have our statewide numbers. But I do have some of the hospitalization data. And you can see that's wrong because they now doubled up to 6 hospitalizations. Good news is no one's in the ICU and no one's on a ventilator. Now the county just west of there. Why do we want to see that? There's a reason why. They only have 5 hospitalizations. They have a relatively low vaccination rate. They have a population, it's Clearfield County, Pennsylvania. They have a population of 80,082. They have 2 hospitals. One small one, Penn Highlands, Clearfield, and one that's slightly bigger, Penn Highlands, Du Bois. Look at this. Adult ICU beds, 0. Medical surgical beds, 0. Pediatric ICU, 0. Pediatric, 0. Guess what? They have no beds for a county of 80,000 people. That's ridiculous. And they also have a very low vaccination rate. Gee, I wonder why that is. Post-COVID effects causing people to get hospitalized, clogging up the hospital? Yes, they had I know this area very well. They had a health problem before the pandemic. Heart disease, diabetes was high in this area. But come on, there's no bed space available, and that's going to start eventually spilling over into other counties, such as Center County. Now, Center County's doing good with bed space. They have 17. So they could take some of the overflow from Clearfield County, as could Blair County, Pennsylvania, which has 41 beds available. And by the way, they have 9 hospitalized, 2 in the ICU, 2 on ventilators. And real quick, let's look at Pennsylvania statewide, 566. And I know some of you followers of mine are from the Philadelphia area where I live. Here's Philadelphia. 70 people hospitalized in our city. That's actually relatively low because for the longest time, I mean probably a year plus, we were over 100 in Philadelphia County. Alrighty, moving on to New York State. Not much to tell you here. 714 new cases, again below 1,000, that's good. Test positivity rate, 2.1%. 7-day average is 2%. Moving on to hospitalizations. We had thought maybe New York City was going to start to rise. Well, first off, here's the statewide level. 870 hospitalized, 104 people in the ICU. Now let's get to New York City. Look at this. They did see that leveling off and signs that maybe they were rising last week. And check this out. They are actually not rising. They are dropping even further. Hospitalized, 241. Patients in the ICU, 40. Yeah, it's continuing to drop. How low will it go? I honestly don't know. We did get an update out of Texas today. And good news here. Texas is down from last week. 4,538 new cases. 3,783 probable cases. 8.21% positivity rate. Newly reported deaths at 66. Hospitalizations in Texas are at 1,092. So they're not far off from dropping below 1,000 hospitalizations. But do look at this. They did try to almost do so back on the 9th. And it shows here a couple days have started to rise again. So that's something we will have to watch. Walgreens, I wish I could show you Walgreens. I will. But this is not up-to-date data. We haven't had an update. Look at the chart. We haven't had an update since the 7th. Hopefully this is not the end of Walgreens. We've seen this happen before where Walgreens does not update after a holiday. If they don't update next week, that's truly concerning. The most recent update has 23.2% positivity rate. Moving on to the latest update from BNO. This includes cases from data from yesterday. 13,219 cases. Average, 17,673. That's down by 56. States reporting, 12 out of 50. When today's comes in, it'll be closer to 25 states. In the hospital, this continues to drop. 15,501, down by 710. In the ICU, 2,066, down by 146. New deaths, 190. Average deaths, 259. That's up by 1, but that's not much, and it's just because the reason why it's up is because of the holiday weekend lag. Finally, ending out today with the international data. We do have some more countries rising. South Korea, cases are up 2%, deaths are down 9%. Russia's down 16% on cases, up 8% on deaths. Japan, cases are up 13%, deaths are down 21%. France, this is new, I believe. France is now up 26% on cases, down 26% on deaths. India, still up 76% on cases, and up 47% on deaths. They're now at 42,283 cases in the last 7 days versus 24,043 the previous 7 days. Coming down here, Germany is down 45% on cases, down 21% on deaths. Malaysia, cases are up 49%. Deaths are now up 300%. That looks like a high number, but here's why. 12 deaths this week, or at least in the last 7 days. Previous 7 days were 3. So that's why that's such a big number. Siberia, 11% decrease in cases, 6% increase in deaths. Indonesia, cases now up 25% and deaths up 20%. And anytime you see the deaths starting to rise immediately at the same time cases do, that to me seems like a country is really under testing. Saudi Arabia, cases are up 33%. Deaths are up 400%. Again, 5 deaths versus 1 death. That's why that's such a big number. All right, that does it for today's pandemic update. We will have another update again tomorrow. I think we're going to have an H5N1 update tomorrow. Don't hold me to that. If it doesn't come tomorrow, it'll come over the weekend. Thanks for watching. And if you enjoyed this video, hit the like and subscribe button down below. I will see you all again next time. But until I see you again next time, continue masking. N95 or better. No flimsy cloth mask that doesn't do diddly squat. N95 or better. And stay safe, everyone. Take care. Thanks for watching.